February is American Heart Month, a time when all people, especially women, are encouraged to focus on their cardiovascular health. This Heart Month, the Centers for Disease Control and Prevention is encouraging women to listen to their hearts and speak up for their health. We are joined for this Mindful Monday by Dr. Qasim Raza, cardiologist at Mayo Health System in La Crosse. Good morning, Dr. Raza.
Good morning. Thanks for having me.
Yeah,
again.
thanks. Nice to see you again. Thanks for being here. So, as we said, CDC focusing on women in particular this Heart Month. Why is heart health something women should pay attention to?
So, heart health is something that everyone should pay attention to, not just women, but particularly women, because of two major reasons. One is that prior to menopause, there are certain hormones which are protective in the female's body, and they protect against heart disease. After menopause, that's not the case. There are changes in the levels of those hormones, and that protection is lost.
Okay.
That's one major reason. The other reason is historically, for some strange reason, there was a little bit of women were a little bit at a disadvantage as far as heart disease and the symptoms of heart disease go, because a lot of the research that was done regarding the symptoms and presentations with heart disease was focused a little bit more on how men presented as opposed to how women presented.
Okay.
Now, when men presented with symptoms which were thought to be, okay, A, B, C, these are the symptoms for heart disease, they were thought to be as typical symptoms of heart disease.
Okay.
Females typically presented with different symptoms, and they were called atypical symptoms. That does not mean that one is right and the other is not right, and that doesn't mean that one set of symptoms is correct, the other is not correct. But unfortunately, we've lived by that criteria for a long period of time. So if females are not complaining of, say, chest pain, even though they may be having a heart attack, they may not get that initial EKG in the ambulance. They may not get that initial rush to the heart center. There are several things which they may be at a disadvantage for. So females in particular, if they know they have risk factors like hypertension, high cholesterol, diabetes, if they smoke, if they're sedentary, if they have all of these risk factors, any changes which feel like they're having symptoms of heart attack, which include fatigue, nausea, vomiting, and just a sensation of back pain, neck pain, all of those things can hint towards having heart disease. So don't ignore them.
Okay. Any other symptoms that women in particular should be looking out for? So
those are the symptoms which females can have more predominantly. Like I said, the nausea, vomiting, sensation of burning in the stomach and behind the chest. But don't ignore the typical symptoms as well. I'm using the word typical, but that's just the nomenclature which we're trying to get away from, actually. And those symptoms again include chest pain, central in the center, radiating to the arm, to the jaw, and to the neck.
Okay. Yeah. Are there any screenings that are recommended for women then, and what age should they, if that is the case?
Great question. Screening per se is recommended across the board for men and women, but particularly if women are interested, if they again have risk factors, even as early as the age of 20, 25, you can get screening. Now, that screening can be for high cholesterol levels, that screening can be for development of diabetes. If you have family history, which is a major genetic risk factor for having heart disease, that in itself should prompt you to get screening earlier. There are blood tests we can do, there are EKGs that you can get. You may, if needed, prompted from these testing, can get a stress test, can get an echocardiogram. These are all different modalities that we have to help us decide if you have underlying heart disease.
Okay, so genetics is one of them. Any other risk factors women should know about?
So amongst the others that I spoke about, one thing which stands out particularly is smoking.
Okay.
Now, women tend to not smoke as much as men, but I want you to realize that once you lose that benefit from the premenopausal era from the hormones, that smoking is going to kick in and cause a lot of trouble. So you are increasing your risk of having more heart disease. Another thing that we don't think of more frequently is alcohol. There was this old paradigm that a small amount of alcohol is actually helpful for the heart, which is actually not the case anymore. As of January of last year, I believe it was WHO came out with information regarding no amount of alcohol is beneficial for your heart.
Right. Yeah. So that old myth of red wine is good for the heart is just not the case.
Unfortunately, no. Yeah. Okay. It's hard to give up, but it is something that needs to be considered.
Yeah, especially if you have those risk factors.
Exactly.
Okay. All right. Well, Dr. Raza, thank you so much for joining us and sharing these helpful tips.